As you know, peripheral arterial disease affects over 12 million Americans and over 200 million people around the globe. It is associated with compromised quality of life and major adverse cardiovascular outcome. In this paper, we pose the question of whether there is a relationship between peripheral arterial disease and the development of atrial fibrillation. Hello, everyone. My name is Fadi Shamoun. I'm a consultant in the Department of Cardiovascular Medicine at the Mayo Clinic in Arizona. Joined with me today is Dr. Andrew Tseng, is a cardiology fellow at the Mayo Clinic in Rochester. I'd like to introduce to you our paper, Lower Extremity Arterial Disease Predict Incident Atrial Fibrillation and the Clinical Outcomes, that will appear in the Mayo Clinic Proceeding, May of 2021. Dr. Tseng, lead us into this paper, please. Thank you.
All right, thank you, Dr. Shamoun. So in order to investigate this, we looked at all adult patients undergoing ankle brachial index testing for any indication at the Mayo Clinic from 1996 to 2018 without a known diagnosis of atrial fibrillation. Overall, this included over 33,000 patients. We obtained baseline demographic, ABI, and echocardiographic data using the electronic health record. We were interested in incident atrial fibrillation as our primary outcome of interest, and we also looked at incident ischemic stroke as well as all-cause mortality. For the purposes of our analysis, we looked at patients with low ABI, which we defined as less than 1.0, normal ABI between 1.0 and 1.39, and high ABI greater than 1.4. What we found was that after adjustment for demographic and comorbidity variables, patients with low or high ABI had increased incidence of new onset atrial fibrillation when compared to those with normal aciobrachial indexes. These patients with normal ABIs also had increased risk of ischemic stroke and all-cause mortality. When we looked at echocardiographic abnormalities, we found that patients with abnormal ABIs had greater left atrial volume indices, left ventricular mass indices, and right ventricular systolic pressures, as well as lower mean left ventricular ejection fractions, all of which were also associated with an increased risk of incident atrial fibrillation.
Thank you, Andrew. I think this is an important study question that highlight the relationship between peripheral arterial disease and the development of atrial fibrillation, both of which share a number of risk factors. Please join us and read this paper in the May edition of Mayo Clinic Proceeding. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.